Your questions before you go in to see them.
Hi everybody, I'm Marla with 9 Health, and we are here at 9 News today because it's Buddy Check 9 Day. So we're talking about skin cancer today and the really importance of reminding each other to kind of check our skin and really check the places that you can't check. If you don't have a partner, you know, you can check your back and you know, the backs of your legs and everything, but reach out to someone today and really remind them to go ahead and check for anything that they see that's unusual on your skin. We have some people from UC Health. We have Dr. Della Valle here and Hanya Flatten. She's a med student who is going into dermatology, and so they're answering questions on the phone. They were on the TV, and we have some props here, so they wanted me to wear this green hat. What do you think? But we're going to find out why this hat is really, really important in a minute. They also have this machine that we're going to be able to see what the skin damage is on my skin. They did it before, and they're going to show me the picture in a minute and talk me through it, like what happened to my skin. And we have some sunscreen here. This is probably one of the big keys. So a hat is really good, and wearing clothing, protective clothing. But this sunscreen is great, and so they brought it here, all the different kinds of samples.
Yeah, thank you for
calling. And one of the things you want to know is that sunscreen is, you got to put a lot on. So you think it's just a little bit, but you got to put like a shot glass, they say, of this stuff. So you put all on and then slather it on, okay? So sunscreen's important, especially here. We're going to find out in a little bit, is it important to put sunscreen on because we're at such high altitude? Is it more important here than other places? So we're going to find that out in a minute too. So we're gonna, as soon as he gets off the phone, right? So we want you guys to be able to get your questions answered. You can type them into the feed, and these guys will answer your questions. And people are calling in as well, asking their questions, right? So Dr. Della Valle, you're off the phone. Thank you for joining us.
Of course.
We started our Facebook Live.
Great.
I was introducing
Hello,
everybody
out there on Facebook land.
We all have hats on, isn't that great? And so we were talking a little bit about sunscreen. Is there anything special about this sunscreen that you brought?
Well, we like to recommend any sunscreen with an SPF of 15 or higher.
Okay.
And the one that you're going to use is the one that we like the best. So,
well said.
And you want to put it on every 2 hours while you're using it.
Okay.
Because you can't sweat it off or get wet and have it rub off. I was just talking to somebody who got sunburned even though they were using sunscreen because they didn't put it back on.
Reapplying is key.
Reapplying is key. So between the hours of 10 a.m. and 4 p.m., that's when you're at risk for sunburn. That's when you want to seek out shade, wear a hat, wear clothing, wear sunscreen.
So 10 a.m. and 4 p.m. is really the most risk. Now, is there any better sunscreen like the ones that say they're going to be waterproof? Are they really waterproof?
Those are better for if you're like going on a long bike ride all day long. There's some that are kind of greasy that don't wash off. So those are the ones that we really recommend for those occasions.
Okay, great, great. So there are some that are a little bit
this one's next.
better. Okay, so he's going to answer the phone, and we're going to actually go ahead and talk to Hanya. She's going to show us a little bit about what we did in this machine. So all I did here earlier is I put my chin here like this. And I didn't have glasses on. She took 2 pictures, and then this is what happened.
Cancer Task Force at a number of
so Hanya, tell us a little bit about this picture.
Sure.
So first of all, that's me, okay? And I authorize you to tell everyone what happened to what's going on with my skin here.
Okay, great. So this is the first picture with just a normal flash. And then this picture here, we put a special filter over, which shows where UV damage is happening. So first of all, if we look just on the cheeks, we see freckles. And freckles are normal. That's just part of the person.
Is that sun damage, though?
Freckles, not necessarily. They can be, and freckles will come out when people are in the sun more. But we're more interested in the regions that are coalescing. So like we're looking at this forehead here, and your forehead just has a darker appearance than your cheeks. And that indicates that you are getting more sun to that region.
So that's why I need to wear this hat, right?
Right.
If I wore the hat, it would protect my forehead.
Absolutely.
Okay.
And one thing that your hat is it's a wide brimmed hat. Lots of golfers or sports people just wear the baseball hat, and that's not quite enough. You're getting a lot of sun on the sides in that case.
Yeah, you know what? That's what I used to do is when I ran a lot, I would just wear a baseball cap. So this is much better.
That's
what you're
certainly
saying.
better. Harder to run in though.
Yes, yeah. They would laugh at me, but they laughed at me anyway. It's okay.
All right.
And this one, it said on it, it had a tag, and it's actually SPF material.
Yes, so there's certain hats and there's certain clothing that is rated for SPF protection, so you can pay attention to that when you are buying
And that
clothes.
really works. This is better than just a regular old hat I bought at, the drugstore.
It's better, but like Dr. Della Valle said, the best hat is one that you'll wear. So find one that you like and wear it.
Okay,
Yeah.
touche, got it.
Yes.
So what else are you seeing here?
So another pattern we see on your face, which is common in many patients, is that this left side is a little bit darker than the right side. The right side is just a bit whiter, and that is, do you know why that is?
I think it's because that's the side we drive. That's where I drive. The wind, the sun comes in on that.
Exactly.
Yeah.
And so that's certainly the case, that our left side of our face gets more exposure, and also you'll see, especially people who drive for a living, their left
I bet
arm
my arm,
will be
yeah.
affected.
And what about right here? Whoops.
Oh,
We
so
lost our
down
picture.
at the chin.
Yeah, the lip right here.
The lip. So
Right here.
the lip is an area that people sometimes forget to put on sunscreen. We put it on our cheeks and our forehead, but that lip can get missed. So there's a little bit of darker area here on that that part of your lips.
And I will tell you, I do. Now that you tell me
Yeah.
that, is I probably put on sunscreen, but I probably do forget this part all the time.
Yeah. And then another thing to remember is the chapstick. So if people aren't using the SPF chapstick, they're definitely not putting sunscreen on. Their lips doesn't taste good. So try to have that chapstick with you as well. Your lips look pretty good.
Okay, good. Woo!
Yes.
I don't know if I use sunscreen on my lips. now
But,
that
you know,
mention it.
women who use anything on their lips, oftentimes that's some sort of protection. So women tend to have a little bit of better lips than men.
Okay, great.
Yeah.
Great. So this is a really cool tool. Do you use it in your office, or how
Yeah,
how
we
can
do.
people-
And, well, we also have events. So we'll go to like a 5K or other events in Colorado, and we'll bring the camera with us, and then participants can come and take a look, and we counsel them on where they can do a better job with their sunblock and with their hats.
Okay, good. Well, so now we've got Dr. Della Valle back with us,
Yes.
and you guys, we were just looking at my picture.
Oh, did we look at your
Yeah,
picture?
We looked at
You
my
got it
picture.
taken?
I did.
Did it make you feel like you wanted to wear sunscreen and not go
I
in the
put my
sun?
hat right on. My wide brimmed hat, not just
Yes,
any hat.
You got it.
So, but she's been trained well, because she said the best hat is the one that you're actually going to wear.
Yes.
So,
Just like the best sunscreen is the one that you're going to put on every
Yeah.
2 hours while you're outside.
Yeah. So, well, tell us before you get to the phones again.
Yeah.
Maybe I don't know if you can answer the phone
Absolutely.
while we do. But tell us a little bit about how big a problem skin cancer is, because this is Buddy Check 9 today,
Yes.
and we really want to talk to people about being careful, checking your skin, and calling your buddy. And
Yeah.
telling them to check their
Okay,
skin
yeah.
too.
Well,
so, how big a problem is skin cancer?
What skin cancer is the most common cancer that there is.
Yeah.
And what I like to tell people is that if you're doing a breast exam, you should do a skin exam
Oh,
too
good.
at the
Good,
same
yeah.
time, once a month. And if you have a buddy helping you with your breast exam, or if you have a partner, they can look at your back. And great. If you don't, you can use mirrors.
Mirrors, yeah,
Or you
very
can use
good.
iPhones. Take
Oh, you
pictures
can
of
take
your
a
body.
picture.
Yeah.
Now, what are we looking for? And
You're
where-
looking for moles.
Moles.
Or bleeding lesions that are changing.
Okay.
So often the moles will have multiple colors, or the major thing is that they're changing, or they look like an ugly duckling. They don't look like any of your other moles.
Okay. So if they're bleeding, they're
Changing, getting irregular shape,
irregular shape,
unusual colors.
unusual color. So we want to look for all that when we're doing
The
our,
major thing is change,
Change.
and looking for an ugly duckling.
So that would be why it's important to check it all the time, right? Because you wouldn't
Yeah.
notice change unless you're looking everywhere.
Yes, and there are some places that you can, there are some apps where you can take pictures of your moles, and they'll store the photo, and you can go back
Oh, that's
and
smart.
see if it changes.
That's smart. Okay, so take a
Yeah.
picture. Very good. And there are different kinds of skin cancer. Which are the most
There are.
common?
So there's basal cell carcinoma, which is the most common, and it does not metastasize. It does not go anyplace else in your body, but it kind of just grows until you have it taken care of. Then there's squamous cell carcinoma, the second most common skin cancer, and that one can, in rare events, go other places, especially if it's on the lip, on the hands. We think those metastasize or go to other places most commonly. And then there's the most deadly kind of skin cancer, and that's melanoma. So melanoma is cancer of moles, and it is deadly because it metastasizes or goes to the brain, the lungs, and the liver. And once it's there, it's very hard to cure. But we are making tremendous progress. There are a lot of new treatments for melanoma that weren't around 30 years ago.
Okay. And is it important, would it be more treatable and easier to treat if you caught it earlier?
Earlier the better.
Okay.
Just like everything.
Yeah, right, it's true. We try and tell people that all the time, you know, at Nine Health, that's pretty much our mission, is really to have people be proactive
Yes.
about your health. And so this would be another time when we'd be,
Definitely.
you know, encouraging you to do that. But it's always great when you hear it from an expert, right? You've seen probably both cases where, you know, people caught it early and it was treatable, and then
Yes.
people didn't catch it early,
Yes.
and maybe what happens in those cases.
Yes. Well, we like to catch it early. It's never too late to start doing the right thing as well.
That's good. Good. Well said. So what are the treatments? What do you do if you do see a cancer?
Yeah, most of the skin cancers, the first step is to biopsy it and find out if it is a skin cancer or not. So
Okay.
you'll go to the dermatologist or to your other primary care physician, and they will, if they're concerned, numb the area and take a biopsy of it. And then sometimes it needs stitches, sometimes it doesn't. And then that piece of skin is sent to the lab and looked at under the microscope to see what kind of skin cancer it is and if it is skin cancer. And then from those results, then the treatment is determined.
And that biopsy is pretty non-invasive, right? It doesn't.
Well, you don't want to have it done unless you have to.
It's not for fun.
It's not for fun. It does leave a scar. It's not easy to biopsy the skin without leaving a scar. So
Okay.
you don't want to do it unless you have to do it.
Okay.
But it's relatively minor compared to other things that doctors do to people.
We won't mention those here today.
Yes,
Right.
yes.
Right. Well, very good. And so, if you are thinking about your skin and wanting to know, can you get it checked? You can get the skin checked at some Nine Health fairs, and we do have health fairs all over the state coming up here this month, right now, this weekend. So you can go to ninehealthfair.org and search by screening to see if there's a skin screener at the health fair near you or where there is a skin screener. So we love people that all the people who are checking skin at a health fair are qualified to do so, and they're volunteering their time. So if you are concerned about something, you can always go to a Nine Health fair and check that out. And I know you guys sometimes volunteer at health fairs too, so
Yes,
thank
and
you
we bring
very
our
much.
cameras around, and I'm going to be at the health fair at Anschutz on the 21st
Okay,
at
great.
8 a.m., so I needed to let you know.
Yeah, thank you. Now this is a little bit controversial, right?
Yes.
So Kim Christensen was just over here, and one of our 9 News friends, and she was saying, why do people continue to go to tanning beds?
Oh,
It's so
yeah.
dangerous,
Yes.
and it's just proven really time and time again to does it cause skin cancer, or what happens in it?
Yeah, you increase your risk of skin cancer if you go to tanning beds. And some people get a high or they feel good when they get tan. So that can be an addiction. People can go get tan, just like smoking. They can smoke even though they know they shouldn't and have a hard time giving it up. So there
Yeah.
is a certain addictive property to some, for tanning for some people.
What would you say to people though that are still doing the tanning beds? Is there some
I'd say
advice
it's
you'd
better
give?
to do the spray-on tan because you aren't going to damage your skin long term. And I think if you get one of these pictures, it'll help motivate you not to use the UV tan, to get a spray-on tan if you really want to look tan.
Yeah, I'm gonna do wear a hat. That's what I'm gonna do. I'm
Yeah.
gonna get
You will
sunscreen
stay
all
looking
over.
younger.
Yeah, you won't get as many wrinkles,
You
right?
won't get as many wrinkles. You're
That's
not
why I
younger
do
for
it.
longer. That's why everybody should do it.
You know what? I think that's right because a lot of times we don't do things that we know we should do for our health, like we don't exercise and we don't eat
we
the
know
right
what
things.
we should do and we don't do it.
But-
for a lot of reasons.
Exactly. If you tell me, well, if I won't get as many wrinkles, now I'm
A
interested.
lot
Now
of people
I'll do
get
it.
motivated by wrinkle reduction, definitely.
So is it true though? You won't get as many wrinkles if you
It's
wear
definitely
sunscreen
true.
and you
It's
stay.
definitely true.
Yeah.
UV light causes the majority of wrinkles.
Yeah. And what else? I mean, how else can you protect your skin? You're out in the sun. We don't want people to stay inside. We love to go outside.
Right. So I wear a hat. You want to seek
Got
out
my hat.
shade. You
Shade.
want to wear clothing. You cover up if you can. If you can't do all that, then wear sunscreen and put it on every 2 hours.
And to put on. Okay, there you have it, from the doctor's mouth, and you will have less wrinkles that way.
You will.
Which is the most important thing.
Of course.
Just kidding. The most important thing is your health, right?
They're both important.
Okay, they're both important. Okay. Well, really great. We're going to actually wrap up here. If you still have questions, you're welcome to type them into the feed, or you can still call for a few minutes here. And we'd love to talk to you about your concerns and your skin cancer. and please call a buddy and have you guys both check your skin today. So thank you very much. We'll see you next time.